Good afternoon and Happy New Year's, everyone. Thank you for joining PHCA for today's webinar, Emergency Preparedness and Life Safety Code Update. I'm Kara Barmoy with the Pennsylvania Healthcare Association. Before we begin, I have a few housekeeping items to cover. PHCA offers monthly webinars to members to receive updates from department staff on regulations, learn from industry experts on current trends and practices, and to gain a better understanding of practical application tools to equip you so that you may continue to provide highest level of quality care possible. This webinar is being recorded and will be made available on the PHCA website. The webinar has been approved for 1.5 continuing education credits for PHCA members. Credit will be uploaded to NAB within the next 2 hours for those who have provided us with your unique NAB number. I'll be sending a link to a quick survey. Your feedback is important to us and our speakers, so please take a moment to complete the survey. All attendees will be on listen-only mode. However, throughout the presentation, please feel free to submit questions using your questions pane on the right hand of your screen, and our presenter will address them at the end of the presentation. Today's webinar is being presented by Charlie Schlegel, Director of the Division of Safety Inspection for the Pennsylvania Department of Health. Charlie will be providing an update on the Life Safety Code requirements used for state licensure in the federal certification, along with an overview of CMS Emergency Preparedness rules. Common deficiencies related to emergency preparedness and life safety will also be discussed, and how to avoid these deficiencies and ensure compliance. I'll now turn the webinar over to Charlie.
Thank you very much, and good morning, everyone. Happy January 2020. We start the new year. I appreciate everybody joining in for the webinar. Like we were talking before, we're going to start with some CMS Emergency Preparedness update, because as you'll see that they even had another update last November that came out. So they're still refining their emergency preparedness requirements, so we'll go over what changed and what didn't change for nursing homes. I've been talking a lot, and I kept it in this webinar for the alcohol-based hand rub placement, so we'll go over that some more, because there's a big push to try and make sure that that's available for our staff. And then we'll do some life safety code updates, and then some general long-term care updates in reference to some of the things going on in the nursing home world. So we'll start with emergency preparedness. So last year, there were 2 updates to the emergency preparedness rules. So the first one was CMS letter QSO-19, and that was all emergency preparedness because it affected all 14 facility types. And it says updates to Appendix Z of the State Operations Manual. And for those of you that don't know, the State Operations Manual, commonly referred to as the SOM, S-O-M, is the CMS's statements to the state agencies on how to survey. So Appendix Z is available online to anybody wanted to Google CMS Appendix Z, and you can kind of see how CMS is telling the state agencies to apply their emergency preparedness requirements, so that it's not the most exciting things to read, but if you're really into emergency preparedness, that is definitely a resource available to you. So the February 1, 2019 update talks about emerging infectious diseases, the definition of an all hazards approach, the new home health agency citations, a little bit outside of the nursing home realm there, and then it talks a lot about alternate source of power and emergency standby systems. So we'll go over that because it's still kind of confusing even with their updates. So the first one, your all hazards approach, and I highlighted in yellow that the big thing is that they wanted to add planning using all hazards approach should include emerging infectious diseases and those threats. So they have some examples here, which is influenza, Ebola, Zika virus, and others. If you've been watching the news, it was mostly China, but I guess now I think I just heard one this morning in Seattle. But there's the coronavirus, so it is something that, as we see these different types of diseases and threats, they wanted to add that to the emergency preparedness plan. So when we go to the next slide here, you'll see that it's I put in the deficiency tag is E004. So what they did is they say these include, but not limited to, and then there at the end you see emerging infectious diseases. So, a lot of questions on what those might be or what I need to do to protect my facility against these types of diseases. The CDC has a lot of information, so you can go right to the CDC and go into emerging infectious diseases or the diseases in search. You can put that information in, and they can give you some good information back. But you'll see here that the main things that we still have in our plan when we're looking at emergency preparedness is the natural disasters, man-made disasters. You can see care-related emergencies are there, equipment and utility failures. Unfortunately, that's something that is a lot of times outside of our control and does happen more frequently than we would like. Interruptions in communication to include cyber attacks. Hopefully that's not something we see, but it is something we see quite a bit outside or all over in different types of businesses. Loss of I should say power to a portion of the facility or all of the facility. So the interruptions to the normal supply and essential resources, water, food, and fuel. So these are all the things that we need to have in our plan. So we should have already had those in the plan, and we can add emerging infectious diseases. Something you won't see on here is a 13-year-old daughter screaming because her light bulb went out in her room. But that's something that I had to deal with last night. But what we do need to keep an eye on is especially these diseases that you see that are popping up around the world, and then seems to move our direction as folks travel. So the next thing that they updated last year in February, and we'll talk about this quite a bit on the different slides, is when we're doing our facility assessment, especially when we're talking about what type of energy source we have. What they're trying to say is that they're not requiring you to have some type of brand new generator put in or new types of emergency power systems put in, but that you need to do a risk assessment of your facility, and off that risk assessment have a realistic idea of how long your facility can stay open and still provide quality care. We don't want if you're in your plan, you put down that you're going to stay open for 5 days anytime you lose power, then we're going to expect you to have a system that can realistically do that. And in Pennsylvania, unfortunately, we do. I guess it's fortunate for some, unfortunate for others, but we have the 4 seasons. So you do have the hot summers where we have concerns if the power goes out that it gets too hot. And right now it is pretty frigid outside. So if we lose power, then we're worried about not only being able to have the resources to cook meals, provide care, all those things, but we also have to make sure that we can keep the environment a safe temperature. And we'll talk about this later, but we want to make sure that you have all the resources available to you. So it's very important to have that good relationship with your local emergency preparedness folks, because they have the abilities to bring in things like generators and heaters and things that can fans and cooling machines to help you out. We just actually had one recently that they're back up and running, but the last couple of days they lost their heating source, so they were able to get a hold of their local emergency preparedness folks who brought in heaters for them. What we don't want is folks running to Home Depot and buying all the space heaters you could find and running extension cords and things like that. We want to reach out to the local emergency preparedness, have them come in and use the resources that are available to you. So you'll see here again, all in red is what they added. They do have a note that the temperatures in a nursing home, if you were built after October 1, 1990, is to maintain a temperature range of 71 to 81. So what we have to do is anytime that we're in a situation where it's either like right now it's in wintertime, let's say we lose power, we're keeping the temperature within that 71 to 81, we're in great shape, but we need to just do a constant assessment. Okay, now we're starting to get down towards 71. We're going to have to start talking about maybe evacuating if we can't get the temperature back up in time, and making sure that the residents aren't put in a position where the cold weather, or if it would go above 81, the warmer weather would put them in a position where their health care and safety is at risk. So this is, again, where they're saying you want to do the facility risk assessment. So you really want to do that risk assessment, determining the best way to maintain temperatures, emergency lighting, fire detection, extinguishing systems, and sewage waste disposal. And if that's through, we'll talk about portable generators here in a little bit, but if that's through a portable and mobile generator rather than a permanent generator, they're gonna have requirements for those, but it's a little bit different because, and we'll talk about what they're really talking about here with portable and mobile generator. So we talked before about the local emergency preparedness having resources. They might be able to bring a generator in to tie into your building. And this is more what we're looking at in reference to portable and mobile generators. It's not something like me where I do a lot of camping and things, and I'm involved with the Cub Scouts. So if we're out doing something where we might have a generator that I got from Bass Pro, that's a little bit different situation. Here, what we're talking about is more having a power company or somebody bringing in a generator to supply power in the event that you lose power to the building, and that those requirements are a little bit different because we're not going to expect them to have the same testing done. So we're not going to come in and do a survey and say you had a emergency generator brought in by your local power company and it was here for a week providing the power. Let's see, the monthly testing. Did you, was it a diesel? Did you have to do any type of, runs? Did you do your weeklies? This is more for your permanent generators. Those are the requirements we look at for those. But the idea is, in an emergency situation, yes, there are some requirements you need to meet in NFPA 70, the National Electric Code, but the expectation is not that we're doing all those testings and require you to do all those testings for something that's coming in an emergency situation just to get you back up and running until you get power. So per NFPA 70, portable and mobile generators should to have all wiring to each unit installed in accordance with the requirements in Chapter 3, be designed and located so that you're not in an area where you're going to flood or be vandalized, those types of things. Adequate ventilation, so it's something we have to make sure that we're looking at our HVAC systems and also not affecting them going into the building. We don't want to have any sparks going against some combustible material. And then the next page, what you'll see here is extension cords or other temporary wiring devices may not be used to connect electrical devices in the facility to a portable and mobile generator. So these portable and mobile generators that they're talking about are more ones we're bringing in and tying into your normal power system to provide power. We're not talking about, like what I was saying before, the one you might take camping that you got from sports store or a hardware store, because you can't use extension cords. We can't have a generator with extension cords running inside the building. So that's really not what they're looking for. Type of protection needed for the fuel for the facility has to meet the appropriate standards. And what you'll see, if your facility has a permanent generator, which pretty much everybody does for their buildings, then that's when we have to have all the fuel storage testing. Everything needs to meet the requirements. But when you have a mobile portable generator brought in during an emergency or something like that, the requirements are going to be a little bit different because we just need to get you up and running and provide the power for the residents. So what you see here is they made some changes to tag 18. So this one's kind of like a common sense one I've talked about quite a bit last year. So if your local municipality, state, region declares a state of emergency, is requiring a mandatory evacuation, what they're saying is facilities should abide by these laws and mandates. So if you're along the Susquehanna River and they're saying, hey, it's going to flood, we need to get everybody out of here, then we need to follow those requirements or follow that mandatory evacuation. This is a good one that they changed to tag 37 in case you have some staff that might travel between facilities. So what they're doing here is making a change that if you have somebody that goes to different facilities to provide care to the residents, or they're working at the facilities, that the expectation is that they get trained in your emergency preparedness programs, and then you only have to train them one time. So because they go to 3 different facilities, they don't have to get trained in their role in all 3, and you have to keep record of that. Is that they know what their expectation is of what happens in emergency for them, what their role is, but you only have to train them one time and then have that record just available. So that's what here they're going into that a little bit more, and what they're saying is, how do we figure this out? A lot of times it's through interview, just like we would with kitchen staff. If there's a kitchen fire, we would interview and say, what is your role? What happens if the ANSEL system doesn't go off? Those types of things. As long as they understand what their role is in the emergency, then they can be just trained at that one location. This one's kind of another common sense one, and also a little bit unfortunate. So as you know, you have to do 2 drills throughout the year. And in the past, what they were saying is if you had an actual emergency, you could count that as your drill. And what they're saying here is if you're unfortunate and unlucky enough to have 2 emergencies in the same year, you can count those both as your drills. So if you have 1 actual emergency at your facility, you can count that as your 1 drill. And if you would have a second one that same year, you can count that as your second drill and not have to do the actual exercises. That's something that we were kind of already doing, and unfortunately, some folks, with some of this crazy weather we're having, they do have more than one type of emergency where they have to start using an emergency preparedness plan. And in those cases, they could use those as both their drills. Here again, they're getting back into the portable mobile generators. So we talked about this, quite a bit already. So if something happens and you need to bring something in, they're just going over what those requirements were, which we've talked about previously. And what they're doing here is just where we talked about the requirements earlier. They're just saying it's found in NFPA 110. So this is where you can find the requirements on where to locate a generator properly. We've had some instances where we've had some generators get flooded and those types of things. We actually had a lot of folks trying to figure out generator placement in city locations, where we've had some flooding as well in the basements. But then sometimes when you're landlocked, it's a little more difficult, because if you put it on the top of the building, then you have to worry about fuel and some of those dangers as well. So it's taking a look at the different generator location requirements and making sure that we're doing our best to put it in a safe location. Okay, so then in November, CMS came out with another additional change to the emergency preparedness requirements to keep us all on our toes. So this was Final Rule CMS 3346F, Omnibus Burden Reduction. If you want to see that, you can look that up online. So it seems like we've been constantly changing, or the CMS has been constantly kind of updating their requirements. I'm knock on wood, we're kind of getting to the end of those changes, so that everybody is aware of what the requirements are, and we can kind of just stick with what we have. So these went into effect November 29th of last year. There hasn't been any real formal guidance from CMS to the state agencies. They haven't really updated the Appendix Z or anything like that we talked about before in the SOM and State Operations Manual to give us any real guidance. So we're just going off of what the changes were until such time that they get some guidance out. So the first one is the emergency plan. So what you'll see here is that it eliminates the requirement that the emergency plan include documentation of efforts to contact the local, regional, state, and federal emergency preparedness officials and a facility's participation in collaborative and cooperative planning efforts. So it's a little bit confusing. So the requirement is that you still reach out and that you still do this, but they got rid of the requirement that you have documentation proving it. It was a little bit of an odd change for a regulator because typically we're going to say, okay, did you contact your local emergency preparedness? Did you try to set up a drill with these folks? And the easiest way to demonstrate that is say, yes, here's the email, or here is the plan for the drill coming up, and it's really easy to demonstrate that. So it's one of those where you might want to keep doing it regardless. That way there are no questions that you did it, but they're still requiring you to do it. They just took out the requirement that you have documentation in your emergency preparedness book showing that you did. Okay, so for some facility types, there's more changes, but for whatever reason, CMS decided really not to change nursing home requirements that much. So what you'll see in here is I put them all in just in case you're somebody that does work in maybe like a surgery center or a hospital, so you'll see that. But also in case you hear from other, say if you go to an emergency preparedness convention and they're talking about, well, this got changed and you only have to do it once, or you don't have to do this. I want you to be able to see that changed for most facility types, but it did not change for nursing homes. So what you'll see is it says training, with the exception of nursing homes, the staff training requirement will be every other year rather than annually, but nursing homes must continue to do annual training. So you might hear that emergency preparedness training got moved to every other year, but that is unfortunately for everyone other than nursing homes. Nursing homes still have to do annual training. So that's why I kind of put both of them on here, and you'll see a couple other slides that are showing some changes, but it's very important to understand it did not change for nursing homes. So testing, here they went to testing for inpatient facilities. So whether you be a nursing home, hospital, inpatient hospice, those types of things. They talk about increasing the flexibility for one of the testing requirements to be a facility's choice. So we'll talk a little bit about that. You're still going to have to do the full-scale exercise that is community-based. That's the big one they want everyone to do at least once a year. So when a community-based effort is not available, so if you're in an area where they don't have anything available to you, they will allow you to do the facility-based functional exercise. So if you're in, I grew up in north central PA and mile-long dirt road up in a mountain. So if you're in one of those areas where they might not have the ability to do something that's community-based, then you can focus on something that's facility-based, whether you do some type of drill where your facility loses power or your facility is flooding, those types of things. That would be a facility-based functional exercise, but the requirement is still that they want you to participate in a community-based drill once a year. Then your second exercise, so we always have to do two in nursing homes and in inpatient facilities. So the second exercise, if you like the community-based drill and they're having another one, you're more than welcome to do another full-scale exercise that's community-based. Your second one, if you do a community-based one, your second one could be an individual facility-based, like we were talking about before, where it's just your facility that's doing the drill. They talk about a mock disaster drill. but we're still waiting to figure out some guidance on what their definition of a mock disaster drill is. So that's something that once we get that, I'll start adding that to the slides, but at this point, I haven't received anything back. But your second drill could be a tabletop exercise led by a facilitator with a group discussion using a narrated, clinically relevant emergency scenario. So when we were back looking at the different types of drills, if you're like we talked about, if you're somebody that lives along the Susquehanna River and you're worried about flooding, you can maybe have some index cards. Somebody picks one out and okay, this one is okay. The facility is flooding. Our A wing is down. We need to move residents somewhere out of the A wing until we can get the restoration company in. And you have the key leadership for the facility, talking and having a facilitator there saying this is what's going on. So you're the administrator. What are you doing? So you're our maintenance director. What's going on in this way, in your world, and just talk through what you would do in an emergency scenario, and that would be your tabletop. So those are the things that they have available. It's really very similar to what it was before. I don't really see much of a change other than they added the mock disaster drill. And once we get more information, we'll put that out. So I'm not going to spend a lot of time on these, but I just wanted to let everybody know, in case you're hearing it, that the testing got changed from 2 exercises per year to 1. That is only for outpatient facilities. So your surgery centers and those types of facilities only have to do 1 per year now, where they used to have to do 2. But for inpatient facilities, hospitals, nursing homes, you're still at 2. So regardless if somebody's telling you that it's got changed to 1, it did, but not for nursing homes. And here, if I just included the slides in case somebody does work in the outpatient facilities, that you can see what your options are. Okay, so as we know, the 2012 Life Safety Code was adopted in 2016. And the reason I put this in here is I've been doing some work with the Patient Safety Authority, and they're really asking me to put out the hand sanitizer information to nursing home folks and actually all healthcare facilities. But for some odd reason, every time they talk to people in healthcare about putting in more hand sanitizers, the healthcare facilities kept telling them that Charlie won't let us. So what I'm trying to do is kind of go over, Charlie will let you, but we just have to follow certain rules. And so we have them here. Your corridor has to be at least 6 foot wide to have hand sanitizer. The individual dispenser, these are the ones mounted to the corridor walls. So you'll see 1.2 liters and 2 liters in suites of rooms. We don't really have a lot of suites of rooms in nursing homes. That's more of the hospital world. So we'll stick to the 1.2 liter for dispensers in rooms and corridors. You also see aerosol containers, but I'm going to kind of stick more to the gel that you see. That's more common. If anybody wants to talk aerosol containers, we could talk about that. Dispensers must be at least 4 feet apart. That doesn't mean we take our tape measure and mark every 4 feet and put them in a quarter, but it means they have to be at least 4 feet apart from each other because of the fire hazard. This slide is something that you'll see here in yellow is the biggest information that if anyone takes out of this part would be the most important sentence to do that. But you'll see the top says not more than 10 gallons of the solution can be used outside of a storage cabinet in a single smoke compartment with the exception of the following. So you can have 1 dispenser in every room that's not counted towards the 10 gallons. So every nursing home, every hospital, surgery center, any healthcare facility, you can have 1 dispenser inside a room, and a room is 4 walls and a door, so it's not the privacy curtains and that type of thing. But you can have 1 dispenser in every room. So even if you don't put hand sanitizer out in the corridor, if your facility wanted to have the extra ability for hand sanitation, you can put a dispenser in each room. So here you see just a picture of the kind of smoke barrier and talking about the 10 gallons. And I kind of broke it down on how many dispensers that is at the end so you have an idea of what you're looking at. So storage greater than 5 gallons in a single smoke compartment has to be in a rated storage cabinet. Typically yellow, they meet NFPA 30. Because they're healthcare, they're usually a little more expensive. Anything just healthcare typically is. But if you run into a great deal and buy all sorts of gallons of hand sanitizer, if we go over 5 gallons, it has to be in a rated storage cabinet. Dispensers have to be at least 1 inch below or to the side of an ignition source. So when we're putting them in the rooms or out in the corridors, but especially in the rooms, typically everybody wants to put them right at the entrance of the door, where also is our light switch, or sometimes our receptacles down below. So what we have to do is keep it at least 1 inch away. When the rules first came out, it was 6 inches, then 4 inches, but now it's down to 1 inch away. So it gives us a little more flexibility. Like I was saying before with the 4 feet, I wouldn't measure exactly 1 inch and put it away, but 1 inch or further away. You cannot be over carpet unless you're fully sprinklered, which is not a problem for nursing homes. We're all fully sprinklered now, and we're up to 95% alcohol content by volume. You'll see here, we joke around a lot with the reference to when you're making regulations. Apparently, we can make all sorts of regulations, but here's some kind of things that the dispenser, you don't want it to be releasing its contents as people walk down the hallway and walk past it. You want the hand underneath it and working properly. You'll see 4 inches of the sensing device if it's a touch-free activation. And they have a requirement that it doesn't keep going off. If you want more hand sanitizer, you put your hand back in. So it just works one time per activation. A little bit difficult one to control, but a dispenser should now dispense more solution than the amount required for hand hygiene consistent with label instructions. So the idea is to really just make sure it's working properly, and it's not dispensing a ton of hand sanitizer that might be getting down the corridor wall or the room wall and onto the floor and causing issues. You'll see here some extra requirements. So you want to make sure this top one is kind of, maybe if you have a dementia unit or some type of, we see a lot of facilities that are doing more with drug and alcohol. If saying 95% alcohol, it might not be a good idea to have them available where residents can get to them. Thinking that they can ingest it would be a bad thing. So we want to make sure that it's used for hand sanitation. And then actually the last requirement is every time somebody replaces it or puts a new refill in, they're actually supposed to test it. It's not something we're actively running around and making sure, but it does make sense to make sure that it's tested after it's refilled and it's working properly. All right. So we talked before about the 1 per room as being something important. So if you figure out, and this is coming from the guy that when I was cooking, I have a hard time between teaspoons, tablespoons, cups, quarter cups, all that stuff, but I checked the math multiple times. So 10 gallons is 31 1.2 liter dispensers. So you could have 1 in each room, and then you could actually have 31 out in the corridors, nurse stations, elsewhere, and still be within the requirements. I mean, you'd be at the total max, but you would still be at that requirement. And then that's remembering that the 1 dispenser per room does not count towards that 31 total. We said before, rooms have 4 walls and a door, so it's not per exam area where we have just a privacy curtain. And then if you do get over 5 gallons of storage, you have to put that in a fire-rated cabinet. And here's just a picture from NFPA 101 just showing that 1 inch rule. So even if the hand sanitizer is stored 5 feet above the electrical receptacle, we still need to have it 1 inch to the side. Fire door maintenance. So this was new to the survey process in November of 2016. and it was one of those things where I've talked to the folks from NFPA 80 that wrote the requirements, and they kind of knew that it was one of those things where the first couple of years would be very difficult trying to get everything worked into the program, but the goal was once those older doors were inspected and maybe some new doors replaced them, that it would become a little easier over the years. So hopefully that is the case, but it was definitely something with the inspection and testing of the fire-rated doors that was new, and I mean, it was quite a process to undertake. As you can see here, there's all sorts of requirements between clearances, whether bottom door, side of the door, and then you have self-closing hardware, you have coordinators, so there's lots of things that you have to test on the fire doors. But hopefully, since that was November of 2016, and now that we're all the way into unbelievably 2020 now, that we have those processes down, and our fire doors are in a little better shape than they were a couple years ago. And the importance of the fire doors is, healthcare is such that we want to defend in place, and the best way to defend in place is to be able to, get ourselves into the different zones. So if there's an issue in the room, if we can get the residents out of the room, close the door, typically that gives us 20 minutes of protection to get everybody into the next smoke compartment, which gives us an hour. Trying to make it so that we don't have to evacuate outside, especially in like a day like today, or this weekend. I think there's supposed to be another winter storm or rain. I'm not sure if they figured it out yet, but it's not the greatest to get residents outside in adverse weather conditions if we can kind of manage the situation inside. So fire-rated door assemblies apply to new and existing. So we're inspecting all our fire-rated doors, and that's once a year, and we have that written record. Functional testing by knowledgeable individuals. That's what we were talking before. We figure that out through interview statements. So if we go up to somebody and say, okay, Charlie, you're the one testing these doors. Can you talk to me about how what's the size of this gap, or how did you test the coordinator on this? And as long as I can answer with the appropriately, then that would be a knowledgeable individual. They don't have to be certified. There are classes out there. I think there's a little bit of a break in some of the ones in Pennsylvania, but there are some national groups that are still doing it through the American Society for Healthcare Engineering, where you can go. It used to be a 2-day class. I understand now it's down to a 1-day class. I've taken the class. I think enough of us complained that 2 days of class on fire doors is a little too much. So I'm kind of glad they do have the 1-day option. But that's definitely something that's available, but that's not something that's required. And we always talk about repairs made without delay. It's something that fire doors take a long time to get ordered, to have come in. They're not sitting on the shelf somewhere where you can just go pick one up all the time. So without delay is getting that order in, getting the money prepared and sent out so that we can have the door coming without any delays. But it doesn't mean that we identify the fire door and then we go out and to the local hardware store and get one and bring it in the next day. The fire doors just don't work that way, and it takes a little time. So you see here, this is right out from NFPA 80 in case anybody wants to know like the basics of what we're looking for. So you see no holes or breaks, visible signs of damage, parts are missing or broken, door clearances. I don't have them all in here because depending if you're a metal door or a wood door, the clearances are different, or if you have double doors. But you do have a set of clearances. They actually make some tools out there that you could buy online. They're little gauges that actually have all the dimensions on it, and you can stick the gauge into the different door gaps and figure out if your door is compliant with the clearances. So those are helpful and available online as well. Self-closing hardware. Something important to note here is you can't fire doors with the being labeled by the manufacturer. They're very specific into the fact that You can't, I think I have it on this page, there's no field modifications that would void the label. So if we decide to put in a large metal kick plate on the bottom and we screw it in, that likely is voiding the label on the door. So we can't do those types of things without it being, so it's pretty much almost like a fire door that comes. We can't really make any changes to it in the field unless it's somebody that's from the manufacturer or approved by the manufacturer to make those changes. So you'll see here, we talked about a coordinator in case you have two doors. The one door closes and latches first, so the second door latches. Latching hardware operates properly. No hardware that's going to keep the door from closing. I think I have a picture somewhere of a fire extinguisher put in front of a door to keep it blocked open, and we can't use those. We can't use the little bricks that somebody decorates or paints. No door wedges, those types of things to keep the door from closing. If you would happen to have horizontal sliding doors and some vertical sliding and rolling doors, there are requirements for those as well. Sometimes we do in some of our separations to other buildings, but it's not as common to have these types of doors. But it's definitely one of those things where we want you to be active in your door maintenance program, and a lot of facilities, it's getting the information out to the staff saying, hey, if you have, if the door's not opening right and it's sticking or it won't close, please put in the work ticket and so we can get it fixed, rather than waiting for our annual inspection to go out and find that it's not working. Receptacle testing. So this is something that we've checked with NFPA who writes the code in reference to, because there's some confusion about whether it's applied to nursing homes, but they did say it does apply. So you'll see that we should be testing our receptacles at patient bed locations. And it says patient, but also that's what we checked, but that applies to nursing home residents as well. Where it gets a little bit different is if you would have vent patients and the medical gas piped in system, you would have requirements for hospital grade receptacles in those locations. But the general rooms could have, where you don't have vent patients in a nursing home, you could have regular receptacles, not hospital grade. But you'll see here that sometimes we do have the hospital grade, so the requirements are a little bit different for both. So what they're saying here, I gave the section of NFPA 99, is that you have to test the receptacles at intervals, and they talk about defined by documented performance data. But the biggest thing that you want to see here is receptacles not listed as hospital grade in our bed locations and our resident bed locations shall be tested at intervals not exceeding 12 months. So if somebody has and they want to talk about changing the interval from 12 months to a larger interval, that's something they want to work out with their field office, because what you're looking at here is documented performance data. Is I went out, checked them all, every receptacle worked, we didn't have any issues. I go back out 12 months later and I don't have any issues again. So next time I want to go out to 18 months and do it 18 months. But you have to show that performance data, and you can't have any real failures, because then you're not demonstrating that you have the performance data. So the easiest way is just to do the 12 months. If you want to talk about something other than 12 months, that's something that you want to have that documented performance data and go to your field office and say, this is why we think we can go to 18 months or a different time frame. We talked a little bit in reference to fire extinguishers. The big thing that changed is we're looking to make sure that the individuals that are doing the annual or maybe your hydrostatic testing and those types of things are trained in NFPA 10. So if you're doing the quick checks monthly, you don't have to be trained in NFPA 10. This one's a lot easier one to get, though. There's lots of options online. So it's one of those things where if you're doing any type of maintenance, recharging of the extinguishers, you have to be certified with some type of NFPA 10 training. NFPA 10 is the authority on fire extinguishers. So if you're doing the monthly quick checks, no, you're fine. You just need to be trained to know what you're looking for. But anyone that's coming in to do the annual needs to have that certification. We had a lot of folks in the beginning try to tell us that I have one person back in the office that's trained and they train everybody else, but they need to have some type of class certification for the person that's coming in on site. I've talked quite a bit about this since NFPA 101 got updated to the 2012 edition. So it's one of those things where the 2010 edition of NFPA 13, which is referenced by 2012 NFPA 101, has a new requirement for privacy curtains. So apparently they went out and did some studies. They found that the 18 inches of mesh was not allowing the sprinkler water appropriately to go from one side to the other side of a privacy curtain. So now they have the requirement that the mesh be extended to 22 inches down from the ceiling. And the big thing to remember, here's some pictures of the privacy curtains so we know, but the big thing is that it's for newly introduced cubicle curtains in sprinklered areas. So all of our nursing homes are fully sprinklered. So your existing privacy curtains can stay 18 inches, but if you renovate the space, you decide to buy some new privacy curtains and replace the existing ones, and then that's when we want to go to 22 inches of mesh. So if you don't change the unit, don't renovate, don't do new construction, they can stay 18 inches of mesh, you're fine. But as soon as we replace them with new curtains, that's when we need to use the new ones with the 22 inches of mesh at the top. Or you could drop your curtains 22 inches down from the ceiling. But it's something that is very important that you make sure that nobody's going out and saying, hey, I got a really good deal on privacy curtains, and then find out that the old 18-inch mesh. But so be careful of that. But the new requirement is 22 inches for new privacy curtains. And a lot of us know the 18-inch rule down from the sprinkler head to keep all our storage and everything. So is that now the 22-inch rule? And no. So everything else is 18 inches. They did not change that, but they did change the privacy curtain for new privacy curtains to 22 inches. So I know a lot of folks have the red tape on the wall, or maybe the yardstick with 18 inches marked with so they can go around making sure that everything is down from the sprinkler head. That still stays the same. The only change was the privacy curtains. So this one we have a little bit of time yet. So with the July 5th, 2016 adoption of the 2012 Life Safety Code, NFPA 101, there's a new inspection requirement in NFPA 25, which is NFPA 25 is the requirements for sprinkler system inspection and testing. So there's a new internal inspection of piping that was added, but it gave 5 years for facilities to do it. So you have to do this every 5 years. So we have till July 5th, 2021. It's one of those things where I wouldn't recommend everybody going out in June of 2021. And I'm sure I'm not the only one that's I can't believe it's already 2020. So 2021 will be right around the corner. But what you want to have done is the internal inspection of your piping and branch line conditions shall be conducted every 5 years, and they have to open a flushing connection at the end of one main and move a sprinkler toward the end of one branch line to do this inspection. And what they're looking for is foreign organic and inorganic material. We'll take a look at what that looks like. But I'm just trying to give everybody a heads up. So when we go out and do your survey this year, no, we're not going to ask for this. But come 2021, midway through the year, we're going to start looking for this. And if everybody is asking the sprinkler companies to do it at the last minute, they're not going to be able to provide that service because it's a little more invasive than your normal survey, your normal testing and inspection by NFPA 25. So here's some pictures of inside. You can see they scraped some of the material out. But if anybody has been unlucky enough to see the sprinkler system go off, It's not shower water. It can be pretty dirty. So what you're looking for is you don't want to see the picture on the right where we have all the sorts of slime and material inside the sprinkler pipe, because then our sprinkler water is not going to come out properly. So if we do find materials, then you're going to get put on a program called obstruction investigation, and that's a little even more invasive. So this 5-year test is kind of the goal is to have them do the inspection. The sprinkler pipes look good. Then we'll come back in 5 years. If not, and if we do find a bunch of material in the pipes that would obstruct the sprinkler system from working, then we have to do the more requirements that are listed under obstruction investigation. So if you have the test done and they say, hey, we have so much material in here, you have to do obstruction investigation, then that's something you can talk to the field office about and see what that means in NFPA 25. But it's more of an investigation to make sure that foreign material isn't going to stop your sprinkler system from working when you need it the most. So speaking of a sprinkler system, so there was a change in NFPA 25 that some people aren't aware of. So what I want to do is kind of briefly go over that. So it depends on what your sprinkler system is. So you might have to go back and say, hey, do I have this? But that's why it's on the slide. But your electric motor-driven pump assembly, sometimes you don't have enough water pressure and you need some type of pump to push the water through your sprinkler system to get the proper pressures. So the previous requirement was they had to be inspected weekly, but now that is monthly. So if you have electric motor-driven pumps for your sprinkler system and you're still checking those weekly, you can push that out to monthly if you'd like. We're not going to complain if you keep it weekly, but it is something that you can change to reflect the change in the code. The other big one, so I hear this quite a bit. I go out to people and I ask them, how many times a year do you have to inspect your sprinkler system? And they're going to tell you, or they'll tell me 4. And that was based off the water flow alarm devices having to be tested quarterly, but that got changed to semi-annual. So while there's some things you should be checking weekly and monthly, making sure that the valves are open or if they're locked or things like that. But the actual testing where you're having the sprinkler company come in, if folks are still doing that quarterly, you really can do it semi-annually now, because the only driver of the quarterly was that you also had to do semi-annual testing of the water flow alarm devices, and that was something that the sprinkler companies were doing. So, that's something you want to look at, hopefully save you some money, is going from quarterly sprinkler inspections to semi-annual, where you have your sprinkler company coming in. So that is, a big change that a lot of people are still doing the quarterly, and like we said, we're not going to penalize anyone for doing more than what their current requirement is. But if you're looking at cost savings, that's something that you might be able to look at. NFPA 110. So this is something that if you have a diesel generator, so some folks might not have a diesel generator, but if your diesel generator doesn't reach at least 30% of the nameplate rating during your monthly generator exercises, you have to do what they call an annual load bank exercise. And the 2010 edition permits that to be 1.5 hours, where it used to be 2 hours. So if your diesel generator, I always joke around that generator salesmen are the best salesmen in the world, because they sell everybody a generator that's way too big for their facility. It sounds great, but unfortunately sometimes if you don't actually have enough hooked into your generator, the generator that is a diesel generator doesn't burn the fuel properly, and then you have wet stacking problems in the exhaust, which can cause a lot of problems. So that's why you have to do the annual load bank test to blow all that carbon out. And so if you're one of those folks that your facility is set up that your generator isn't pulling at least 30% of what it can, you have a couple options of, one, putting more on your generator to get a better load, or you can to get above that 30%, or you can do the annual load bank exercise. But note that if they're still doing 2 hours, you could save yourself some fuel and go to 1.5. So we talked about a long-term care update. Everybody knows that there's the big changes on the Division of Nursing Care Facility side, where a lot of your F tags were changed and those types of things. But they did make some changes to physical environment for the resident rooms that were not quite as forefront as the others. So we'll go over those, and then we're waiting, and hopefully we see something soon from CMS because they actually proposed a rule to change this a little bit to make it a lot easier for some existing nursing homes to renovate. So where it stands right now is that if you come in for a plan review to renovate an existing facility or to build a new facility, the new requirement is that each bathroom has its own commode and sink. Or each resident room has its own bathroom equipped with a commode and sink. So what this means is, in a lot of our existing facilities, we have the bathroom in between the two rooms and it's shared. So going forward, they don't want that shared bathroom anymore. They want each resident room to have its own bathroom with a commode and sink, and that's for any type of construction going forward. So you're in your existing facilities, they're not saying you have to do construction, but if you say, hey, we're going to renovate the Oak Wing, and you have bathrooms that are shared between two rooms, that is something that you're going to have to take a look at. And then the other change that they made was that you can't have more than two residents in a room going forward when you do that same type of construction. So what does it mean? So before you get up 4, now they're saying 2. So their definition of reconstruction, this is coming right from Health Tag F911. It talks about undergoes the reconfiguration of the space such that the space is not permitted to be occupied, or the entire building or entire occupancy within the building is modified. And then the requirement only applies to the reconstructed area. So if you have 4 wings and you decide to just renovate one, it only applies to that area that you're renovating. It doesn't mean that you have to go renovate the other 3 wings as well. It just applies to the area that's being renovated. Right now, this is what the requirements are. And you'll see here, it also talks about a change of ownership, or if you get a new provider number from CMS, then you have to meet the new requirements. So if you do a change of ownership and you just assume the provider number of the previous owner, this does not apply. But let's say you decide to buy an existing facility and ask for a new CMS provider number, then by asking for that new provider number, they expect you to meet the new requirements, so then it would apply. Typically, I'm not sure if I've really ever seen any change of ownerships in the nursing home world where they do ask for a new provider. Typically, they ask to assume the existing provider number. That way there's no stoppage of payment, because sometimes it takes CMS quite a long time to get that new number to you so you can get paid, so or reimbursed for services. So that is that big change in November of 2016 when they changed all of the FTAG. I still think they're waiting for phase 3 of the nursing side, but a lot of people didn't see that we made that change. And here you'll see a room that a lot of times we'll see an existing unit where they share the bathroom, and what they're looking at is trying to have a bathroom for each resident room going forward. And like we were saying before, it's sometimes if you add the bathroom, then all of a sudden now you're trying to figure out if you have enough space in the room, for multiple residents, so it makes it a little more difficult. But the good news is, and fingers crossed they do make this change, is that on July 18th, 2019, they did propose a rule that that this is only going to apply to brand new construction, which would really help our existing facilities have that ability to still keep the number of residents they have. The comments closed on September 16th of 2019. Unfortunately, we haven't heard anything since September 16th, 2019, when they closed the comments. So it's one of those things where we're really hoping that CMS comes out and says, we proposed the rule change and we're ready to go. This is when it goes into effect, because that'll really help out a lot of folks that are looking at renovations to their building. So the proposed change is here. Like I said, it didn't get changed yet, but we're really hoping that it does get changed. Is that only newly constructed and newly certified facilities would have the requirement to have a bathroom per room and then the 2 resident limit per room. So if you're in an existing facility that has 4 residents or share a bathroom, you could still do renovations, and that is the goal. Unfortunately, we just have not heard back yet from CMS on whether they're going to permit that. But I'm hoping that they go forward with that proposed rule. The second proposed change from last year that we haven't heard back from since that September closing of comments really affects the people that have the old fire safety evaluation system, the FSESs. So when they changed to the 2012 edition of NFPA 101, and then we were using the new NFPA 101A 2013 to do the FSES, the values changed such that a lot of existing nursing homes that had construction deficiencies no longer met the alternate means in the FSES. So it's been causing a lot of concern. CMS gave a 5-year extension for those types of facilities, but now what they're looking at is instead of the 5-year extension, they're looking at going back to the old 2001 FSES values, where if we would do that, a lot of these folks that, as long as you're not a high-rise, so there is a limitation. If you're more than 7 stories, they would still make you use the newer FSES. But for buildings that had the old FSESs that complied and they met the 2001 edition, this would mean that they can go back to that 2001 values and continue to comply as long as you're 7 stories or less, which doesn't affect everybody, but those that it does affect, it is a huge change. So facilities that met the requirements before would allow them to keep meeting the requirements instead of having to do some major construction to update it, and that would be 5 years from 2016 is 2021, so that date is coming up quickly. So I have a number of people that have been emailing me. As soon as I get an answer on that, we will try to post it everywhere we possibly can so that information gets out. And like I was saying before, this is definitely just a proposed rule, so it is something that we definitely need to wait on. The requirement is still such that if you do renovations in an existing building or your FSES must comply with the newer edition, those still stand. But hopefully we'll get an update on CMS changing that rule, and hopefully it's in the positive, and then we can send that information out. Then the one subject we've been seeing quite a bit is dialysis services within a nursing home. So CMS has been trying to address this, and some of the letters that you could see I listed here. So if you have dialysis in your nursing home, or if you're looking to put dialysis in your nursing home, CMS guidance letters QSO 1822 and 1824 are out there. But to kind of paraphrase, what these say is that you really can have 2 different types to have an in-center dialysis. So you can see here it says transport the resident to and from an off-site certified ESRD, transport the resident to a location within or approximate to the nursing home, which is separately certified as an ESRD. So we do have in-center dialysis, where either we're transporting our residents, somewhere to a dialysis center, and we have nursing homes that either attached to the nursing home or maybe somewhere in the community location, they have a certified dialysis center on site. But either way, you're taking the resident from the nursing home to the dialysis center, and what they refer that as in-center dialysis. So it's kind of like providing other types of services where you have to take the resident out of the home. Then the second version is home dialysis in a nursing home, and this is the one that we've been seeing a lot, and it's been a little bit confusing trying to get everybody on the same page. But this is where the resident receives dialysis treatments in the nursing home, are administered and supervised by personnel who meet the criteria for qualifications, training, and competency verification as stated in the guidance. So we'll talk about a little bit about how that's verified. And you have the written agreement between the nursing home and the dialysis facility. So in-center dialysis is where we're taking our residents out of the facility to a dialysis center. But there is an option for home dialysis that's in the nursing home, where you're providing the dialysis either at the bedside or maybe taking them to a specific room in the nursing home and providing that home dialysis. But there are requirements to do that. So you really want to take a look at the ESRD letters that we had before. I think it was 1822 and 1824, to make sure that you're meeting all the requirements. Because what happens is our home health department, the Department of Health, inspects dialysis centers. So they consider, CMS considers home dialysis, where they're doing it in the nursing home, as an extension of that inpatient dialysis that's certified somewhere down the street that you have the written agreement with. So you could actually, the one thing you have to understand is when they go out and do the CMS survey for the dialysis center that you have the agreement with, even though they're doing home dialysis in the nursing home, that part of the survey task is that the surveyors that are doing the ESRD survey are supposed to come to the nursing home to make sure that they're doing their dialysis in the nursing home in accordance with the CMS requirements as well. So if you would ever have home health, if you're doing home dialysis in your building, and it's, you're meeting all the requirements and everything, don't be surprised that if a surveyor comes and says, I'm here to survey your home dialysis center, that's located, the home dialysis that's being done in your building under written agreement with ABC dialysis center that's down the road. Because it is written right in, and it's in those CMS letters saying when they go inspect the inpatient dialysis center, that they also, if they're doing home dialysis somewhere, that they're supposed to go to wherever they're doing that home dialysis and do their survey there as well. So the one thing, some of these dialysis folks are telling everybody that you can just go ahead and do it. Easy, we'll just get the written agreement. You don't have to do anything. But one thing I want everybody to understand is if you're making this change, you do need to contact plan review, and there are sometimes plan review does require plans for this change, because what we're doing is maybe taking an old activities room and now we want to make it into a home dialysis area, and then there are nursing home requirements for how much activity space you have per resident, so we want to make sure you meet that. And then we're doing construction to add utility rooms and sinks and those things. So it's very important that if you're looking at this option, that one, look at those CMS letters to make sure you're meeting all the requirements. Two, understand that when that dialysis center is being surveyed, you could be part of that survey as well. Not your facility itself, but it'd be coming into your facility to make sure that the dialysis center is doing what they're supposed to be doing. And then third, don't start without first contacting the Department of Health and say, listen, we're looking at doing this. These are the changes we would have to make. What requirements do you have of us? That way we're not doing it retroactively, because it's a little bit easier if we do it in the forefront. All right. So I think I might be a couple minutes early. I was trying to get to, I think I have 11:11. I was trying to get to 11:15, but we're pretty close. So if anybody has any questions, now would be the time.
Thanks, Charlie. This is always really great information that you have to share with us. And we are opening it up to questions at this time. We do have a couple questions that have already come in, so I can start with that. But if anybody has questions, please type them into the question box on the right hand of your screen. The first question that we have is there anything you can add about emergency meal planning / water requirement for emergencies?
Okay, yes. Unfortunately, it's not going to probably be the perfect answer that they're looking for, but it's going to be based off your risk assessment of your facility and what you put in your plan. So when we go out and do your emergency preparedness, and what CMS is telling us is if you say, I'm going to have 3 days worth of food and water, that's what we're supposed to be looking for. If you try to say, I'm only going to have 12 hours worth of food and water, the issue with that is going to be then in 12 hours we're going to expect you to start your evacuation process. So it has to be a balance of, okay, realistically, this is how much food and water we have. Maybe we have 48 hours, and then we have to go get more, and we can have those agreements. But if you put in your plan, we're going to have 48 hours, that is what the surveyor is going to be looking for. So it's really taking a look at what your facility has and making sure your plan is appropriate to that.
Great, thanks. Another question, do fire doors with a label need to be inspected, or is it just the firewall doors?
Okay, so I guess the easiest way to say this is the way that NFPA 80 is written is if it has a label, it should be part of the fire inspection program. But there might be, since we have a lot of existing buildings that over time have been renovated and changed, or went from non-sprinklered to fully sprinkled. And what some facilities have done is had somebody, or they were able to do it themselves, go back through and say, hey, this wall is no longer a firewall. We don't even need fire doors. So these labels don't even need to be on these doors. I'd caution to make sure that you have somebody, that is, very good with the life safety code to make sure that we're not taking away, firewalls that need to be there. But we've had some facilities, especially if you were built in 1970 something and you weren't sprinklered, all your corridor doors had a fire label on it for at least 20 minutes. And now that you're fully sprinklered, they don't have to be rated doors. They just have to be resist the passage of smoke. So by the NFPA 80 code, if the door has a label, it should be inspected. But we might have doors like those that don't really actually need to have that label on them anymore.
Great. All right. There aren't any other questions at this time, but the question period is open. So if anybody does have any questions, please type them in for us. Charlie's contact information is here on the screen, and I will be sending a link to the handout, so you will have his contact information available to you at your fingertips later today or tomorrow. Also, please check out our upcoming webinars. We are getting a full schedule. We're working to fill the schedule for 2020. We have an OSHA update on February 6th. And we have a PDPM for anybody who needs an update on, everything that's been happening with PDPM. We have a PDPM update for you on February 26th, I believe it is. And we have other webinars, workforce related, and we have a cybersecurity webinar that we're pulling together for April. So there's a lot of good stuff coming up. If you have any topics that you want to see us provide information on through webinar, please let me know. We're always open to suggestions. So again, this is a quiet group today, Charlie. I'm not sure. It's a nice day. Everybody must be gearing up for lunch, I think.
That's right.
So I think we'll wrap it up here. Again, a survey is going to be emailed to you. So please take a moment. That information is helpful to us here at PHCA and to our speakers. So please take a moment to complete the survey. And again, be on the lookout for more education through webinars coming up in this new year. I just want to thank Charlie once again for presenting on this topic. It's always timely information, the latest and greatest, and Charlie does a great job at presenting that and is very knowledgeable for us in this area. And again, just be sure to look for those 2020 webinars, and I just want to make sure everybody wishes you a great remainder of your day.